Hello and welcome. Today we're diving into a condition called Epispadias, a rare birth defect affecting the urinary system. We'll explore what it is, what causes it, how it's diagnosed and treated, and what the future holds for individuals affected by this condition. Let's begin. The exact cause of Epispadias isn't fully understood, but it's believed to stem from disruptions during early fetal development. Specifically, it's linked to incomplete closure of the abdominal wall and failure of the genital tubercle to fuse properly. Genetic factors likely play a role, and some research suggests a possible association with certain environmental influences during pregnancy. However, most cases appear to occur sporadically, meaning they don't have a clear, identifiable cause. Normally, during fetal development, the urethra, which is the tube that carries urine from the bladder out of the body, forms along the underside of the penis in males and within the labia in females. In Epispadias, this process is disrupted. The urethra doesn't close completely, resulting in an opening on the upper side of the penis in males, or in the clitoris or abdomen in females. This abnormal urethral opening can lead to issues with urinary control, sexual function, and fertility. Epispadias is a rare condition. Estimates vary, but it's generally believed to occur in approximately 1 in 100,000 males and 1 in 500,000 females. It's less common than its counterpart hypospadias, where the urethral opening is on the underside of the penis. While rare, understanding the condition is crucial for timely diagnosis and appropriate management. The signs and symptoms of Epispadias vary depending on the severity and sex of the individual. In males, the urethral opening can be located anywhere from the glands to the abdomen. This often results in a shortened, curved penis and difficulty with urinary stream direction. In females, the clitoris may be split, and the urethral opening may be located between the clitoris and the bladder. Both males and females can experience urinary incontinence, or difficulty controlling urination. In severe cases, there may be problems with the bladder, neck, and surrounding muscles, further impacting urinary control. Diagnosis of Epispadias is typically made at birth or shortly thereafter during a physical examination. The abnormal placement of the urethral opening is usually readily apparent. Further testing, such as an ultrasound or X-ray, may be performed to assess the extent of the defect and to rule out other associated conditions, such as bladder exstrophy, a more severe birth defect where the bladder is exposed outside the body. A careful examination of the urinary tract and surrounding structures is vital for accurate diagnosis and planning of treatment. Epispadias can be classified based on the location of the urethral opening. In males, classifications include glandular, penile, and penopubic. Glandular Epispadias is the mildest form with the opening located on the glands. Penile Epispadias has the opening along the shaft of the penis, while penopubic Epispadias is the most severe, with the opening located near the pubic bone. In females, classifications are less defined but generally describe the extent of clitoral splitting and urethral involvement. The primary treatment for Epispadias is surgical repair. The goal of surgery is to reconstruct the urethra, reposition the opening to its normal location, and correct any associated deformities of the penis or clitoris. Multiple surgeries may be necessary, particularly in more severe cases. The timing of surgery is usually between 6 and 18 months of age. In addition to surgical repair, ongoing management may include medications to help with urinary control and monitoring for potential complications such as urinary tract infections. Psychological support for both the child and family is also an important aspect of care. Currently, there is no known way to definitively prevent Epispadias. As the exact cause is often unknown, preventative measures are challenging. However, ensuring optimal prenatal care, including folic acid supplementation and avoidance of known teratogens, may help minimize the risk of birth defects in general. Further research into the genetic and environmental factors that may contribute to Epispadias is needed to develop more targeted preventative strategies. The prognosis for individuals with Epispadias is generally good, especially with early diagnosis and appropriate surgical intervention. Many individuals can achieve urinary continence and satisfactory sexual function. However, long-term follow-up is essential to monitor for potential complications, such as urethral strictures or recurrent incontinence. Recent research focuses on refining surgical techniques to improve cosmetic and functional outcomes. Additionally, studies are investigating the potential role of regenerative medicine in repairing damaged tissues and improving urinary control. While challenges remain, ongoing advancements are offering hope for even better outcomes for individuals with Epispadias.